In terms of getting us going, Dr. Pramod, what is obesity?
Okay, let me start by saying what is not obesity. It is not a lifestyle choice that people can choose to be obese or not be obese. It is a disease just like any other chronic disease like type 2 diabetes or hyperlipidemia or COPD. You get changes in your body which are pathological, and it is lifelong, and as a result of these changes you get complications, and hence you have to look at obesity pretty much just like you look at type 2 diabetes or rheumatoid arthritis or any other chronic disease which has got an inflammatory, remitting and relapsing component to it.
Thank you. So it's a disease, not a lifestyle choice, Brandy, is that right?
It's a disease that can be helped with lifestyle changes. So just like, for instance, we have diabetes, how we address our blood sugar control is we take medication, we change our diet, and we exercise. So obesity would be, I would look at it in the same way.
Well, how do we intervene with somebody's lifestyle?
Okay, yes. So I think before we talk about the individual and lifestyle, I'd like to take a step back and look at what are we also doing as a society and what are we doing from a public health policy perspective as well. We'll talk a lot today about the individual, and we'll put a lot of onus on the individual, but if you're also not creating an environment that supports that individual in making lifestyle changes, we're failing our patients and we're failing our society. So things like, do we have a livable minimum wage where people can afford healthcare? Do we have access to healthcare? For instance, dietetic visits are not covered under most insurance plans. Do we have fruits and vegetables that we can afford in the grocery store?
We're hearing it's a multifactorial disease. How then do we start to think about this and address it in a way which is evidence-informed?
I think most of us have come across patients with weight issue, and I'm always frustrated by the lack of the resources we already talked about. Not only do they not get the funding available for seeing dietetics, food is expensive, all the obesity drugs are on the exclusion list of all the insurance company. They would definitely not cover non-surgical endoscopic procedure for help patients to lose weight. And certainly for surgery, it's a real battle. You have to really build up your case, collect your clinical notes from different specialties, including dietetics, physicians, psychologists, really to substantiate to your justification for proceeding to surgery. So I feel I'm really frustrated by the lack of resources available to deliver the care that patients need.
Whilst medication has its place, we're looking at these agents as magic potions. Just like magic, it doesn't last forever. And if you're not doing the background work, as Dr. Choi had said, with your lifestyle modifications, when the clock strikes 12, you're back to square one.